Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
Hello, friend. How are you?
Good. How are you doing?
I'm good. My brain's kind of all over the place here. I do have a topic for us.
Oh, okay.
And I will try to rein my brain in.
Okay.
Because I just feel like what day is it? What month is it?
It's a good
frickin'
slogan.
August, apparently.
Rein the brain.
Rein the brain.
Oh,
yes,
that's good.
Rein the brain. Okay. So we kind of talked a couple of weeks ago about being a saboteur. Do you have a saboteur in your office? Are you the one sabotaging your practice? And I experienced what I feel like this doctor completely sabotaging his own self. And what I liked about it is that it wasn't dental, it was medical.
Okay.
And y'all know I have said over and over again how I think medical is a shit show. And they get away with crimes, as far as I'm concerned, of customer service. Like, y'all should be embarrassed if you're a medical doctor. Like, I don't know you and I've not been in your office, but I can guarantee you are not following proper customer service.
Yeah.
And y'all get away with it because you're medical, and who knows. But how you can stand the lack of satisfaction is beyond me. So bless all of you. I don't know.
Or curse all of you.
Right. Well, yeah. But you have enough on your plate that you don't even know, because you think you're healing and you're God and it's all fine. And anyway.
Tell us how you really feel.
Yes. And so I say this off of endless doctor's appointments I'm taking my parents to. So it's like I'm seeing it in nephrology, hematology, cardiology, PCP, like you name it. I'm going in and out of these offices, and I have yet to find anything that I could commend about any of these offices.
That says a lot.
That says a lot.
Yeah.
That's pretty terrible. So, speaking of terrible, this is one experience that I saw, and so I'm picking on this doc because I really was very tempted to send an email or call his front office and be like, I just feel bad for him. He's young 40s, I think just turned 40 earlier this year. Started another practice around the same time I had started mine. Mm-hmm. I'm seeing so many things wrong with that. He just had a second baby this year. So to me, I'm like, this guy's probably working his tail off, thinking he's making good money. I have not seen his financials. I don't know. But to me, and again, I'm not a consultant. I just know what I know from years of working with you, and then like things that you kind of point out to me, that I'm like, Bethany would probably be like in hives just watching the gross inefficiencies in this office. So he's a pain doctor. So I guess he's an anesthesiologist and then went into pain, whatever. And why I'm picking on him more is because he's not affiliated with a hospital system or anything like that.
He's on his own.
He's on his own.
Okay.
He's like a true private practitioner just like us. So then I'm like, this podcast is meant for, like, even chiropractics. Like, my chiropractor, she's the sole owner. She bought it from the other doc, and so she has listened to some of our podcasts because she's now an owner.
It's applicable.
It's not dental, but it's applicable. So I'm just like, I can see all the things that this guy is doing that I already am going, I am a consultant guru. I am not. But even I'm picking up on these things. And I think why I'm picking on him, one, as a consumer, taking my parents to this practice, we are so fed up with the care we're getting, and I'm going to elaborate on that more. But it's like, for me, I start going, man, these are all like relatively easy little tweaks you could be making to not annoy the shit out of your patients. You're there to help people with their pain. So I know you care about people in pain and helping them. And yet, look at this laundry list of things you are doing that is actually causing your patients pain. You could probably be helping a lot more patients if you would just do these few things of efficiency. And so this last appointment I took my mom to on Tuesday was just like almost the straw that's broken the back. Get it? She's having back pain off, right? But it's to the point where even my dad, who is the most laid back guy, was like, you need to tell him this is unacceptable and you need to go through all of this with him.
Wow.
And so to me, I got home and I was like, did you just tell him all of this? And I was like, no, because he's not doing any of this on purpose.
Yeah.
I think he is that clueless. Because the doc himself, if I were to guess, I'm thinking he's phlegmatic. He reminds me of a lot of phlegmatic people I know.
Yeah.
And so I don't think he has any clue that it could be better.
Yeah.
I don't think he has any clue that it's not what it could be. He thinks he's providing good care. My mom did say, and before he walked in the door, I told my mom, I was like, you be nice. You be nice. Do not go off on him. We just need to get out of here.
Yeah.
We were there for 2 hours for an appointment that should have taken literally 2 minutes. And so I'm about to go through all the things that he did wrong that he's clueless about. Yeah. And so even when we got home, my dad's like, did you go off on him? Did you tell him this is not acceptable? Did you tell him? And I was like, it would have done no good because he has no concept of these things can and should be different. And I think I could tell he was defeated. By the quick thing that my mom did say to him, you could see the defeatedness on his face. Even though she didn't go off on him, she just said, okay, if I come back, am I going to have to wait 2 hours again?
Yeah.
And he was just like, are you mad or whatever? And my mom's like, yeah, like whatever she said. And then that was that. I was like, let's go, let's get out of here. But you could just see the defeat on his face. And I'm like, are you kidding me? Like, that's a surprise to you that nobody wants to sit here and wait for 2 hours?
Right.
So the question becomes, because my sister was like, I was going to call and tell his staff, you need to quit overbooking him. Because I was like, that's the thing. He's not overbooked. Every time I go, there's like 2 other patients in the building. He's just completely inefficient with his time. Yeah. And I have specific examples of how he has been inefficient. So I said, so telling him that is not going to, yelling at them to see less patients, that's not the problem.
Right.
And then he too, I'm like, just looking at his face, I could just tell he probably hasn't eaten lunch today. By the time we left the office, it was 5:30. They close at 4:30.
Oh, wow.
So to me, I'm like, okay, so you probably haven't eaten lunch today. You probably haven't got a pee break.
Yeah.
You've got probably going home to a wife that's dealing with a 4 or 5 month old and your other toddler. So your second job's about to start. You're probably thinking, bitch, I worked you in today, and like you're complaining about waiting, and I'm going to be the one to get you out of pain. Like that's probably what he was thinking as he's defeated.
Right.
I'm like, so it's not like he's sitting there going, cha-ching, I'm just banking on all of this. It's like he has no clue about how inefficient he is. So I will guide you through what I saw, and then you tell me what you think.
I want to hear about this.
So she went in about 3 weeks ago.
Okay.
And we're guessing she pulled something because we went on our beach trip. We sat in the car for a long time. She did have a fall, blah, blah, blah. So we started with the PCP because we kind of didn't want to go to Pain Doc because he takes forever. My sister is the one who usually has to take my dad to his appointments. And it's like we do everything we can to not have to make an appointment because they'll make an appointment at 11. You don't get seen till 1 or 1:30.
Gosh.
And so it's just like, and this is every time for a year. So that's the thing that we laugh about. We know it's going to take that long. So shouldn't we be the ones to be like, well, never mind. Why are we scheduling back in this facility?
Yeah.
But I think that we schedule back because we really do like the doctor.
Yeah.
He does. Once he gets there, then he can help them with their pain.
Right.
He speaks their language. Like he literally speaks Hindi, so he can help them with that. So like finding another provider, it's like, it takes 5 minutes to get to their office. So all the things that matter it's not just for me that's convenient. It's my elderly parents. So for the time they're going to be in the car and the time they're going to... So these things matter. The convenience matters and all of that. And his staff is pretty nice. They're kind of useless, but they're nice. So I'm just like, it's not like you walk in and there's no standing room.
Right.
There's always a place to sit.
Yeah.
So it's like, it works. I think, so for me, the number one bone I have to pick about it is you are trying to help patients in pain, and the majority of your patients, I've never seen a young person in there, I'll put it that way.
Yeah.
It's always somebody who's at least 60 plus.
Okay.
So my first bone to pick is, these people can't sit that long. Or do you not know? Because you're barely 40 yourself, which means are your parents like 60, 65-ish, and they're young and still mobile and haven't experienced pain?
Yeah.
So are you truly unaware of, like, this is hard for them to sit there?
Yeah.
It's kind of like in pediatrics. You come in with an infant, I can't keep you waiting there for an hour, hour and a half, 45 minutes. That baby has feeding times, nap times, attention span times. Like, we gotta move.
Yeah.
So in peds, like, that's where I'm just like, we don't have time to putz around. If your appointment's at 11:15, we need to see you within 5 minutes of 11:15. If I'm delivering good customer service, that's the aim right there. Now, you could say, like, yeah, I'm a Medicaid office, so I've got to pack people in. I still, like, that to me, I'm not okay with that.
Yeah.
And maybe people on Medicaid are going, well, that's how it is everywhere we go. But to me, I'm like, that's not something I want for myself. I will pay extra money to make sure that I go somewhere that will respect my time, because that's not acceptable to me. Because of the situation of now, honestly, to me, the 2 hours we sat there was great for me because nobody was bugging me. I was shooting off marketing emails. I'm sure you could go back at
see
Tuesday
when you were
and see, and you're like, man, I got 5 emails because I was sitting there, I was blowing and going, like things that I don't have time to deal with in the summer. I was able to knock out. But my mom was miserable. It's hard for her to get up, to sit down, get comfortable, and then she can sit there for about 15, 20 minutes, but then now she's in pain again. And to ask us to sit for 2 hours before you walk in the door. I think the other part of it is, in her mind, the reason for this appointment, and this is not the doctor's fault, but it's insurance, right? So it's like she went in 3 weeks ago with pain. She wanted a steroid injection. So she thought this appointment was the steroid injection. Well, I had to tell her because the office called the day before and was just like, oh no, this is not for the injection. This is the follow-up, because they've got to document, which I guess is fair, right? Like insurance company, for once, I'm going to side with insurance companies. You got to make sure that a doctor is not just willy-nilly giving injections to everybody.
Right.
You want to give it the 3 weeks to say, were there any improvements? Has she healed at all? Did she do any therapy? Like, okay, is the injection still warranted, indicated?
Yeah.
So fine. So that's what this is. So I told her, I said, they're not doing an injection. She's like, why? I've been in pain this whole time. I know, but for insurance purposes, they've got to like document. And so this is just going to be revisiting. Yeah, I'm not better. Okay, great. Let's submit that to insurance. So that's why I said it should have been a 2-minute appointment.
Yeah.
Because last time we were in pain, this is where we were in pain, we documented all that, so we should be able to go back and say, okay, last time you were hurting here, any improvements here, any improvements there? No, okay, great, let's submit this to insurance. It really should have been a 30-second appointment, honestly. So I think in her mind, she's like, wait, I gotta go, and I'm still not gonna be out of pain by the time I leave that appointment.
Which is devastating for her.
Yeah, so she's like, okay. So then to sit there for 2 hours, knowing you're sitting there and you're still not gonna feel any better leaving,
yeah,
that's really tough. So to me then I start going, okay, well, first of all, setting the expectation for, have we done that with our patients? If they're coming in thinking they're getting a crown, but they're not. Or I guess in dental, a lot of times patients feel the opposite, where you're going to do all this extra stuff I don't need.
Yeah.
Regardless, point number one, like, did you set the expectation? And luckily they did. They said, this is not to do anything. This is to document.
Yeah, because can you imagine if that would have just come up in the appointment rather than ahead of time? Oh gosh, that would have been a nightmare.
Yes. So then we're sitting there, and my mom is just restless, and she can't. And I think the other part of it is because when we walked in, there was only one other lady sitting there waiting. So you don't imagine you're going to wait for 2 hours when there's only one other patient there. So finally, an hour and a half in, I kind of just said, my mom's like, did they just forget about us? Because they put us in a room at this point, right? And I'm like, I don't know. So I popped out, and they're like, oh, he's just finishing this. It might be another, 5 or 10 minutes. And I'm like, no, it's not. Always triple that. So I just said to my mom, what do you want to do? Because by this point, she was crying. She literally was crying. She's like, I can't believe I'm having to sit here. I'm in pain. Why does nobody care? Why does whatever? And I'm just like, okay, meltdown central here. Like, here we go. So I'm just
and this whole time y'all have been sitting there, nobody's popped in to check on you.
Yeah. So we've been in there for like an hour and 15 minutes.
Okay.
So, because we walked in, right? We sat there in reception for about 10 minutes. They put us in a room. We're thinking our turn's coming soon because nobody else. There's one other person waiting out there.
Yeah.
And you got us back pretty quick. A lot of times they don't get us back for 50, 60 minutes. This time they got us back and we're like, oh, this should be quick because it should just be a documentation appointment and there's nobody else in the waiting room. So then, then nobody came back and that was that. And of course, the 10 minutes really was like 35 by the time he made it in. Okay, so let's get to that then. So he comes in and he's like, okay, so tell me what's going on. I'm like, what?
What?
And so then he's like, okay, so where are you hurting? What? And so then he's like, okay, you're hurting in your back. Are you hurting? Do you feel it down your leg? Do you feel it in your calf? Do you feel it in your glutes? Well, the way he's asking the questions, it's like he's not really letting her finish her answer. So it's like she can't really. And then he says something about, well, did you see your scans? Because he had sent us for a CT scan at that point in between. And so I was like, well, you got the scan. Yes, I saw the scan. So then he goes to his computer to go pull up the scan. And I'm like, I don't want to see the scan.
Yeah.
Well, did you get it? Do you want me to email it to you? No, I don't want to read the scan. Like, what? Like, the point is that she's got a lot of stenoses in her back and whatever. What is the point?
Yeah.
So basically, I think his point was, I could try to inject you between these two vertebrae, but it may not be exactly where your pain's coming from because you've got so in our case, it would be like, I've got a toothache on 3, but actually 5, 4, 2 also have decay and some cracks going on, and so does 30 and 31.
Yeah.
So we think your pain is coming from 3, but I could fix 3, but you may still have more. Okay, great. I get it. My mouth is old. I've got cracks everywhere. I never got crowns. I should have, and I never wore my mouth guard. And so, right, like, so he's trying to set, but I'm like, you're setting that boundary or that expectation of this may not help. Okay, but what is your plan then? So in my mind, I'm like, what is the plan? Then he pulls up the CT. Then he's showing us the views of like where all she's got stenosis. Then he's reading us parts of the report that things she's got. And I was so rude at this point because I was tired of sitting there. And I'm like, now we've come at a time where I think our appointment was at like 1:45. Well, we're getting closer to 4 now, right? Like, so I'm going to hit traffic now.
Yeah.
Get to the effing point already, man.
Yeah.
Read the room. Read the room. We are not, I've already told you I'm not interested in looking at it. You're showing it to me and I am literally looking at the floor sighing.
Yeah.
Because I'm like, I'm trying to be really dramatic to get you to read my body language. I don't care.
Yeah.
What is your plan?
Yeah.
Where are you going to inject first?
And then think about all the time that he's wasted going over information that you ultimately didn't even want.
I didn't want.
You wonder how many patients prior to you he had done that with.
So then, I'm glad you said that, because then at that point, then he said something like, oh yeah, so, because my mom refuses to go for an MRI. Like, she's been in one before, it's too claustrophobic. She absolutely refuses, will not do it. So that's why he said, well, let's send you for a CT scan then. At least we'll get some information. It's not the same information, whatever. So already, like, the patient already knows that you may not be able to do a thorough job because the patient has prevented you from getting all your diagnostic tools. So now if my mom is going, well, why wouldn't you know where to inject me? Lady, you wouldn't let me do the imaging I needed. That's why.
Yeah.
Do you want to go do the imaging? No. Okay, well then we're playing a guessing game here.
Yeah.
You've got to be okay with the guessing game. Which, mind you, my parents have been patients there for like 2-ish years now. We have never came back and said, well, you injected in the wrong place. That has never happened. So again, you don't know your patients. You're having the same CYA conversation that you have with every patient, not reading the room, not remembering your patient, so I'm like, that's a miss in so many areas. Anyway, so he goes, oh yeah, MRI. Oh yeah, you won't do an MRI. Oh, well, whatever. So then he says something about an MRI and well, have you ever had an MRI? You don't ask an elderly woman this random ass question, because then my mom goes back 50 years in time.
Oh, gosh.
Well, the one time I had an MRI, and it was an open MRI because my friend was an OB, and she got them to do an open, and I'm like, oh, for fuck's sake, like, we're going to go back 50. Why are you opening that can of worms?
Yeah.
Who cares?
Yeah.
So then I cut in with, I was like, you know she's not going to do an MRI. Like, this is the best. And he's like, oh, well, we don't even need an MRI.
You're like, then why are we having this conversation?
Why? And then when he was asking her about her pain, same thing. He was like, well, did you fall? Did you whatever? Well, blah, blah, blah. And I was like, so later when I was talking to my dad, I was like, here's the problem. He is asking these open-ended questions of an elderly person. And I'm sorry, any elderly person listening to this, but most of y'all would love to hear somebody, to have somebody to listen to your stories.
Yeah.
So we could be here for the next 45 minutes recounting, well, was it in 1979? Or no, that was the time I stubbed my toe. It could have been in 1980, but was it in the spring of 1980? I'm just like, oh my God, why would you open that can of worms?
Yeah.
You should be smoother than that, sir. You deal with elderly all the time. You know the rabbit holes you could go down by asking stupid questions.
Yeah.
Narrow it down. So later at home, I was trying to make light of it, but I was telling my dad, I was like, yeah, like that's one thing. He's not, A, not reading the room. B, I don't think he's checking his chart notes from before. So you are unprepared for this visit. 3, you're not training your team to help you, which I think is stupid.
I'd say the team could be asking those types of questions.
The team should have been asking those, teed you up. You really didn't even need to poke your head in. You should have just poked your head in and gone, okay, well, this is our plan. This is what we're going to try. You've had no improvements. CT scan didn't give us any truly valuable information. So we're going to start with this injection. That's what I'm going to write for. You good with that? Okay, great. Wrap it up and move on. She had she went to an orthopedist last year, and that's how he was. He was elderly himself, probably late 60s, early 70s. And the way he was able to make you feel like you were heard, did not make you feel rushed, but was really in there for 2 minutes.
Yeah.
Because he was able to say, this is what I'm seeing, this is the plan, and this is why. If this doesn't work, we're going to come back and do this. You good? Mm-hmm. Great. And was just so smooth at all of that. And this doc, pain doc, couldn't do it more opposite backwards.
He was taking way too much time to try to communicate that feeling rather than asking very clear and pointed questions, showing body language that shows I'm really into this and I'm really listening, but I've only got to be in here for 2 or 3 minutes to get it.
Right. And so I think what he's doing, part of it is, I think he is laid back and doesn't, like get on with it. Which I see at every single appointment I take my parents to, which my sister does most of them. The ones I do, I'm like, good God, like, come on, dude. Why are you reinventing everything? So that tells me you either don't take good chart notes, or you're not reading them, or both. You know you're running behind, so now you think you're going to come in the room and charm and kind of listen and talk. But that's the problem, is that nobody wants that at this point when you've waited 2 hours.
Yeah.
You want to be out of that office. And then said something to my mom like, oh, are you in pain? No, we just like to sit here because your chairs are so comfortable to sit in. We have nothing better to do than sit here for 2 hours. Yes, she's in pain. Is that your way of showing empathy?
Right.
Because it's a stupid approach.
Well, and then it goes against it. Now you seem unempathetic because you're asking such a blatantly stupid question. You're like, do you not know me well enough to know that I'm in pain?
Right. That's why we're all walking in the door, because you're called pain and spine. So yes, every person scheduling an appointment is in pain. Yep.
Yeah.
So to me, I'm just like, you're just completely missing. Even when he started his second office, I kind of said something, because it's again around the time I started mine, but I'm like, which of course I've shut mine down and I don't know what's happening with this other one, but I'm like, did you hire an associate? No.
Oh, gosh.
So basically, you have taken all your patients from one office and you've scheduled us in the second one.
Yeah.
What sense does that make?
What's the point?
So was it to gain more patients? You may gain some, but you're only in that location 2 days. Now you're in your primary location 3 days.
But then also, can you manage that patient load?
Right.
If you're already struggling with the patient load that you have.
And you're struggling because you're inefficient.
Yeah.
That's why you're struggling. So opening a second office, how did that help?
Yeah.
So the whole thing, I'm like, who's advising you?
Probably nobody. And also, if he's phlegmatic, he's probably not directing his team in ways that they can help.
Exactly.
He's just like, oh, I got to do it. I'll do it all. And he's got capable team members that are there to help, but they don't know how they can help the situation.
Exactly. So I'm like, what should have happened in this appointment should have been the girl that got us back. And she did ask about my mom, pain. Where are you? What's the pain from scale of 0 to 10? I'm a 9. Okay. No, not okay. Tell me about where.
Yeah.
You can train your team. They're not the doctor. They don't know about the different vertebrae and all the nerves and all of that. But you could have a definite, same as what we do. So child comes in and you're having a toothache. And if the team comes back and says, oh, she's having a toothache, that hasn't helped me at all.
Exactly.
Obviously, you're there for a reason. I see that you're on the schedule for a limited exam.
So then you would just be restating the obvious.
Right. And so then all the questions our team can ask the patient. When are you hurting? When did it start? Do we seem to have any sinus issues? Did we see, is it wet? You know, like they're gathering all of that information for me. Take an IO, take a PA.
Yeah.
So all of that, you're teeing me up for all the things I need to know. So when I walk in, I'm going, okay, I know Johnny's hurting tooth number J, but I don't see any decay on any of these things. You're telling me we're hurting kind of up in that upper left area.
Yeah.
So we're not hurting with hot and cold, and we're not hurting with chewing, right? Did Natalie convey that properly? Yep. Okay. I'm thinking it's sinus pressure because I can hear him. He's very congested today. And by the way, number 14 is soon to erupt, as we can see on this x-ray.
Yeah.
Now, I'm going to take a look in his mouth, make sure I don't see any canker sores or any trauma or anything. But short of that, y'all were just in 3 months ago. We saw nothing on that radiograph, and comparing it to today's, I don't see anything different there either. So my suggestion is going to be follow up with PCP if you need, give some allergy meds, call me if symptoms persist or worsen. But I think if you're wondering if something's wrong, I don't see anything wrong at this point.
Yeah.
Johnny, open up. Let me take a look. Yep. See, Mom, there's no canker sores. Your brushing looks good. Everything seems fine. Is that a workable plan for you? You're going to let me know if anything happens. I mean, we're in and out.
Yep.
I'm not reinventing the wheel. If my team just said we're in pain and then I go in, how are y'all today? Blah, 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 blah. Tell me about this. Tell me about that. And then if I'm at that point going, okay, what x-ray did I last have? Now I'm digging through chart notes. I'm not doing that in front of the parent.
No.
Why? Why trap myself in that room when I could be checking other patients?
But then also, if you came into that, let's just call it unprepared. If you are data gathering yourself the first time, you haven't gone back and looked at the last x-ray that you had on the tooth, you haven't gone back and looked at the chart notes, then you feel this pressure to perform.
Yes.
So now
Yes.
we've got to pull up the x-ray, and we've got this moment where we're like, well, we need to recover and make sure the parent knows that I know what I'm talking about. So let me walk you through this x-ray. Let me show you all the things. So when I think about the pain doctor for your mom, I'm like, I'm wondering if some of that is like, I've got to contribute some value to this appointment to help smooth some things over. Whereas if, like the exact example you gave, if you've done all your homework, your team's gotten all the relevant information, you've looked at the prior chart note and the x-rays, you're walking in and you are already 70% through that appointment. Yes. Now you just need to finish it.
Now, in my office, that patient didn't wait 2 hours. That patient didn't wait at all. They were brought back. But still, the fact that I'm coming in, and if I'm just kind of going, duh, 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 I don't have anything to offer you. When we walk in, I've been able to check other patients in that same amount of time that my assistant's data gathering, and then I come back and I repeat it. So it's not like I'm just not listening to you.
Yeah.
I'm repeating back and going, this is what Natalie told me, that you're this. Is all of that correct? Great. Well, I went ahead and looked at the last note. On the last note, we mentioned that there was no molar. Is there still a molar there? We're not sure. Okay. I don't think so based off the photo we took, but when I compared it to last time, so I'm teeing myself up to look like I'm not just bumbling in here with no knowledge. I'm in here and I have thoroughly armed myself with everything, and I am up to speed on this situation. Yeah. Unless you have anything to add? No? Did I get it all right? Yep. Okay. And you're out the door and out you go. I didn't make you restate everything. And if you are a storyteller, maybe you've got 4 kids and you can't keep your kids straight. And now I've trapped myself in the room even longer because you're like, wait, was that Jimmy or was that Johnny? I can't remember. Wait, who was it? And when were they hurting? And when? But right? Patients can go off and really muddle up the situation. So how are we taking control of that, controlling the narrative, making them feel heard at the same time, making them get the value of why they came? Because if you're leaving and I'm not giving you an antibiotic, I'm not giving you a pain med, I don't have a plan, it's very possible you could leave upset with me going, she didn't listen to me.
Yeah.
Because she didn't spend enough time with me. But to me, my argument back is, was it useful time or useless time? Mm-hmm. And so to me, I think that's probably what he was doing, is he's like, oh, they've waited this long. His team has already told him, I've already popped out asking, are we being seen today or not? And so now he's trying to perform. And I'm like, but I don't have time for this. Yeah. I just want to get out of here, because either way, you're not going to give her an injection today. So there was no reason. His assistant could have gotten all of that information. And then all he had to do was, between patients, excuse me for one moment, pop your head in and then leave.
Yeah.
Now, let's assume my mom was in a chatty Cathy mood and you didn't want to get yourself trapped. Still, that's where you could be like, oh, is there more to it than this? Okay, I'll be back.
Yeah.
And
I want to hear this.
Yeah.
This is important information. let me pop over, get this other patient wrapped up, and I'll be back to listen further.
Right. And that's where we could be like, no, we're good. There's no new information to add. Right? But like, you're setting, I don't know, you're setting everybody up for failure here. And then just you look tired.
Yeah.
It's an hour past when you should have left this building. You're exhausted, but you did it to yourself.
Yeah.
So when my sister's like, I'm going to ream the front desk out. Why? What is the purpose of that? Front desk can't do shit.
Yeah.
Until he decides to train them up.
And then I'm assuming, too, while he's in the room with you, there's nobody in the room with him, like a medical assistant?
There was. Which
okay.
This year, I feel like in the last 3 or 4 months. But I'm like, you're not contributing anything either. Why
Was she documenting?
She was.
Okay, good.
I'm still like,
because then I'm thinking,
need to give her a lot more to do.
If he was leaving now, not until 6 o'clock, does he still have all of his chart notes to go back and review? Does he have all this admin stuff that he's likely doing after patient care?
I would bet he is. I mean, even though he's got her there, just kind of knowing the other phlegmatics I've worked with, I'll leave it at that it probably is going to be done on their time when they're ready to do it. But I'm like, no wonder you're tired all the time. Because I happen to know you just started this other practice and you have another baby at home.
Yeah.
There's no way you're getting enough sleep, enough rest, enough you time, and you're just burning and going, completely oblivious and completely inefficient.
Yeah.
At what point are you going to burn out, dude?
Yeah.
So...
But then I also sit here and think about, as we discuss it from a medical standpoint and the inefficiencies of that medical atmosphere, you're absolutely right. It parlays over into dental all the time. Like, we have to ask ourselves the same questions, like, are we making some of the same mistakes that this doctor is making, and we're either unaware of the impact of those, or we're feeling like we're burning out at both ends and we can't figure out why. Like, I would wonder how many times the way that we're conducting the schedule and managing it, is it truly efficient enough to get us through?
And that's exactly what I was thinking. I'm like, I think I see this because I can tell from my own self going, if I haven't looked at that chart ahead of time.
Right.
Because you're asking what brings you in today. You should know what brings us in. She was in pain 3 weeks ago. You sent us for a CT scan, and you should know that you haven't done anything to relieve that pain. Why do you think we're here? Why do you think?
Yeah.
So you've been running around, and you didn't pause, but could your team member have updated you on all of that?
Have helped you.
But I don't think you've trained your team up to do that.
Yeah.
So they're all sitting around
trying to figure out how to support.
Yeah.
But
there's nothing they can do because you haven't guided them to do that. So for me, like, if I were to be able to say, hey man, I wanted to say, have you ever thought about getting some counseling? Or not counseling, coaching, consulting. Maybe he needs a counselor too, what do I know? But you are grossly inefficient in a lot of ways. But who am I to say that to him? But although I feel bad, I'm like, you're this young doc who's got a lot on your plate, and you've got a gift of helping people. Patients feel comfortable with you. You don't have an air about you. You speak multiple languages, you make your patients feel comfortable, you're not intimidating, you're very knowledgeable, and yet your patients are leaving pissed off and trying to look for other providers because of these inefficiencies. Or they're coming back because they do like you, but every visit they're leaving going, God, am I going back to that place
dissatisfied.
again?
Yeah.
Yes. And it's like, I just feel bad. I'm like, has nobody bothered to tell him this?
Yeah. And oftentimes you can't see that for yourself.
Yeah.
You know something's broken. You know that the day feels far too stressful, but you can't figure out how to fix it. Yeah. And I feel like that's very common.
So my key takeaways there for him that I think parlay to dental as well. Number one, are you training up your team? Mm-hmm. 2, are you doing the prep work you need to be doing? And I think 3 was, I don't even remember what 3 was, whatever I said at the beginning of the episode.
Well, I would say at least 3 on my perspective is, do you have somebody from the outside that can look and evaluate how you're conducting appointments? Because again, to me, the key person in that room with him is the medical assistant. If she's in there with him, then he could consistently ask her, hey, how do you feel like that conversation went? What could I have done to do it better and faster? And if your team can get comfortable giving you that feedback, or pick a couple of patients that you know and trust to go, hey, I'm really working on making the appointments better. What do you like most about the appointment? What could I do to make things more efficient for you? Like, we're so afraid to ask feedback either from our coworkers, from other colleagues. Like, for this pain doctor to go to another private practice colleague office and watch their operations and go, let me see how you do it. Let me see how you conduct that appointment, and take some of that knowledge back. But I think we're so hesitant to do that. And because it's an investment of time, it's awkward to ask for that feedback, or do we really want to hear that feedback? But you play out, what if he didn't do anything different? He's got 2 small kids at home. He's leaving this office way later than he should be leaving it. He's probably got all this admin to do at night. He's burning out at 40. You are talking about your livelihood here. And yes, it's uncomfortable to ask for that feedback and to make the investment of time to get it. But if you don't, you're talking about 15, 20 years of feeling burned out. Like, that's not worth it either. So to me, it makes more sense. Pause, get the feedback from either patients, team members, or colleagues to help you run it more efficiently.
But I think in his case, I don't think he thinks he's doing anything wrong. Like,
Yeah.
the fact that you're waiting for 2 hours doesn't seem to bother him. Like, so I don't know what to say about that.
Yeah, and to me, that should be unacceptable across all fields. Like, if we've got those kind of wait times, and maybe he doesn't even know that there's those kind of wait times, but why would he not know?
Why would he not know? It's a small practice.
You can look at the schedule and be like, hey, so-and-so was scheduled at this time. I got in there at this time. Maybe he doesn't know what time he got in there. Maybe he's not really even paying attention to that, but that's where the team can help too. The softwares, I don't know what medical software has, but a lot of our softwares track the appointment, what time they arrived, what time they were seated. Are we looking at that? If we don't have software that can track that, people can. You've got an assistant in there, have her document. I call it a time study. Document what time the patient got here, what time were they seated, what time did doctor get in, what time did doctor touch a tool to the mouth. How long did we touch a tool to the mouth? What time was the tool out of the mouth? Did he or she have to get up and go to exams? How long were they gone for exams? When did they come back? Like, we can really focus on efficiency if we will try to focus on efficiency. And I think it's time well spent, honestly.
But I think the problem in this case, and I think for a lot of us, is going to be, no, it's not a problem. Or you're supposed to wait at the doctor's office. Or whatever it is, right? Or I'm the only show in town. People will have to come here. I don't know. But I'm like, just for your own satisfaction, not even your own satisfaction, your own productivity.
Yes.
Like, I don't know. It just seemed like we are breathing the air in your office for 2 hours that we shouldn't have been breathing. Like, you should have gotten us on our way so you could pack in somebody else.
Yes.
And I'm sure you didn't get paid much for this revisit.
Right.
From insurance to have to come in and redocument this. So you would think you would want that to go as quickly as you could so that you can get the approval for the big buck procedures, which would be the injections. My mom's like, I don't want to go back there. I'm like, well, where else do you want to go? We're going to have to start over at this point. So, like, we've already made it there, get this one last injection, and then I'm going to try to get you an appointment somewhere else. And we may hate that person even more. We don't know. But luckily, we're not in Podunk, USA. We're here in Dallas. We have options. So that's my, and then this was the only other slight thing that I was saying. Here's an example of a non-sabotage, was the nail salon. I took my niece was in town, and my niece and my one daughter wanted a pedicure. I had already gotten a pedicure about 2-ish weeks ago. I was like, I don't know, I'd rather just be in and out. I walk in with them, they get started. I come in and I sit in one of the empty seats, and I can hear in a different language, that the one tech that was working on my daughter that was sitting next to me hollers out to the manager. The manager comes back and they're speaking in something, and then the manager looks at me and she goes, nah, yours looks pretty good. You were just in a couple weeks ago. And I was like, yeah, I was. I'll be back next week. I want to keep my appointments separate. And she was like, okay. So I know what was happening is that tech was like, here's another victim. Why is she not getting anything done? She's got no polish on her nails. She's got polish on her feet, but why can't we've got 2 techs sitting around that could be working on her too?
Yep.
So to me, I'm like, you are trained to go, who else here could? Like, Scheduling Institute teaches us. Somebody walks in with 4-year-old Johnny and mom is carrying another baby. Has baby been seen? When was baby's last visit? Like, you try to get, it's a win-win for everybody.
Absolutely. It's helpful for, in your case, it's helpful for the parent, because then she's not having to reschedule the baby at a different time. We can go ahead and get that done today. It's helpful for the practice, because we took one kiddo and turned him into 2 today. It's a win-win.
So watching for those opportunities. Yeah. So is your team trained up? And this tech was trained up to go, another victim.
Yeah.
Somebody else. She's got to need something.
Yeah.
We offer waxing. We offer nails. We offer feet. We offer, right? Like, she's got to need something. See what she needs today.
Yeah.
So I thought that was a brilliant example of we're paying attention.
Yeah. This lady's literally sitting in a chair. We can make the most of our time. We've got people available. Let's be super efficient and get her taken care of as well. And absolutely, that's a well-trained nail technician.
Yeah.
How about that? So the nail salons have it down and the medical offices don't. What does that say about us?
Yeah, medical offices. Have I said how unimpressed I am with medical?
I don't know if that's come across clearly enough in this podcast. Let's end with, you think they are terrible. All of them.
All of them. Yes. Yes, that is what I'm saying. All of them.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.